question was, would it be constitutional for there to be a single national health care system that everybody had to participate in order to get health care? And I think the answer to that is that it probably is constitutional, but it doesn't really, it's kind of a moot point because nobody is suggesting it at this stage. The only thing that is being suggested is that there be a public option that would compete side by side with Blue Cross, United, Aetna, wherever you get your insurance. In a way that I think is not particularly different. You're 14, so you'll be going on to college. You'll be making decisions about college, and you'll be looking at, presumably, University of Rhode Island, University of Virginia, University of Michigan, public colleges that compete side by side with Graham University, Providence College, and others. And I think that makes for a healthier range of options for you when you get to that age. And that is what the healthcare system would model itself on. It's not everybody goes to the University of Rhode Island. It's an added choice to the private providers. And therefore, I don't think we need to face the question of whether it's constitutional. But I do believe as a lawyer it probably is. Jack?
We have in the state of Rhode Island compulsory car insurance for everyone who rides, and I don't think anyone's challenged or drives to anyone's challenged that our Constitution.
We'll do this gentleman here in the plaid shirt, and then we'll go to Will in the green shirt.
Hi, Patrick from Wakefield. Thanks for holding the forum. My question is really simple. We have 12% unemployment. We have whole areas of employment where people are working. Everything from dry cleaning to janitorial to food service to restaurants where people get no insurance. So if we don't have a public option, where are those people going to get insurance? And has anyone who is opposed to this amongst your colleagues or in the House, have they put forward a way that people could get insurance who don't either are unemployed or are in an industry that doesn't provide employer-based health insurance? Because that's the problem. We have many, many people who are insured through their employer, but we have lots of people, and that number is growing. And the growth is in small business, the growth is in low-wage jobs. Those are the jobs that are out there, and those typically do not have health insurance. And that's why I'm a strong proponent of public option. Thank you.
The structure that the Senate Health Bill sets up is that wherever you're employed, if you don't have health insurance, you go to the exchange where you can shop among the alternatives, which would include the private insurers and, I hope, a public option. And at that exchange, you are assigned the subsidy that you're entitled to for your health care that offsets, is related to your income as a function of poverty level. So if you are in a very low wage job, you get a higher subsidy in order to better afford the healthcare plans, and then you take that subsidy and you decide where you're going to spend it. And it's the same value whether you spend it with United, or whether you spend it with Blue Cross, or whether you spend it with the public option. It is your subsidy to spend where you want in that exchange. So I think that the biggest value of the public option is providing an alternative business model that focuses less on the areas where the private insurance market has focused itself recently, which has been, if they think you're going to get sick, they try not to give you any coverage in the first place. If you do get sick, they try to find a loophole to throw you off your coverage. If they can't find the loophole, they try to step in and control the care you get and recommend different things than what your doctor has recommended in a way that coincidentally is always less expensive than what your doctor's recommended. And if they get defeated at that, then their fallback is to try to avoid paying your doctor for as long as possible and make themselves as big a hassle. So the public option has an opportunity. The public option has the opportunity to pursue a different and better business model that focuses on more efficiency, quality, prevention, better transparency, and ultimately better health care and better outcomes. And I think that's the real value of the public option.